This is one of the strongest onions that I have ever smelt. Why do I have an onion? I'll talk to you about that in a minute. But first, my name is Dr. Aaron Andrews. Hi, chiropractic neurologist at PC Wellness Centers. Thank you for taking the time out of your day to watch this video. So my esteemed colleague and associate of mine, Dr. Persley, made a video the other day about fibromyalgia. It's a great video. If you guys haven't gone and watched it, check it out. He talked about fibromyalgia, talked about the muscle connections, why you guys experience the pain that you have, why chiropractic is very, very beneficial in helping fibromyalgia and the muscles and the pain and the tension. Great video, a lot of interesting information. So go watch that video. But I wanted to piggyback on that a little bit and continue talking about fibromyalgia. I had a patient this morning. I had a consult with her about fibromyalgia. Very emotional. She was upset, and understandably why. Fibromyalgia is very misdiagnosed, mistreated, mismanaged. There's a lot of bad information out there, and a lot of uneducated people that aren't doing the right things for fibromyalgia, and it's not their fault. Fibromyalgia, there's an uphill battle. Okay, it's an uphill battle with your symptoms, with your fatigue, with your lack of sleep, and just the condition of your illness. But it's also an uphill battle because you're constantly having to convince people, sometimes family, friends, coworkers, physicians, of your symptoms and why you're feeling the way you're feeling, and why it is real. Well, it is real. Okay, it's not in your head. Well, it's kind of in your head, okay? Fibromyalgia patients have a decrease in serotonin and some other neurotransmitters. Those are the chemicals in your brain that kind of communicate and do a whole lot of important functions. And serotonin is a calming chemical. So when you have a decrease in that, your brain is not communicating with your body right, and it's not calming things down. So it is kind of in your head, but it's not the psychological manifestation that some people tell you about, okay? Fibromyalgia is real. Obviously, we just went over that. There's specific diagnostic criteria for it. I'm not going to go into all that, but a lot of physicians and some other chiropractors aren't educated in diagnosing it, especially in treating it. So there's a specific way to do both. Fibromyalgia affects 2 to 4% of the population. I think that number is a lot higher than it should be. 90% of the cases are women. Nobody knows what causes fibromyalgia. Nobody knows why, but there is a lot of information out there that we have learned, and some specialties that we have been certified in and that we have got that allow us to better understand this condition, better diagnose it, and better treat it. Most fibromyalgia patients have gone to 12 different doctors, and they have waited about 6 or 7 years before their diagnosis. They go through what I call the fibromyalgia medical loop of crazy. They go into all these different doctors. They've had a consult, been told to deal with it. They might have had some blood work as normal or negative, x-rays normal or negative, exams normal or negative, so it's really hard to diagnose when you don't know what you're looking for, or you're not educated about the condition like we are. So back to the onion. What makes us, me and Dr. Persley, different at PC Wellness Centers is we treat our patients like onions. And I was going to physically open this up and have a nice little prop, but number one, we have an employee who's allergic to onions. And number two, like I said, this one is really strong, and I don't want to smell my office up. I still have a couple patients left this afternoon. So we like to take the onion and take the layers off. Okay, we treat our fibromyalgia patients like an onion. Okay, we got to take the layers off and figure out what's going on with you so we can better treat it. And then I can kind of use the analogy again with the onion is we treat it different ways. Okay, there's not one cause of fibromyalgia, so there's not one remedy. Okay, you can't just get adjusted, or you can't just go to and get a massage, or you can't just do yoga, or you can't just take supplements. You have to do a lot of stuff together. Okay, and that's why we work with sleep and supplements and diet and exercise and muscle and, most important, chiropractic, and then other things, okay? So that's what separates us. If you guys have fibromyalgia or you know someone that does, please share both the videos that we did about fibromyalgia. Consults are always free. You know, give us a call, 335-9188. Go on the website, pcwellnesscenters.com. There's information there. Come in, find out why we're different, find out why we treat a lot of fibromyalgia cases, and I think we get the best results than anyone around. I appreciate it. Thanks for taking the time to watch this video, and we'll talk to you later.